Afternoon. My name is Suzanne Brundage. I'm a master's student in the Health Policy and Management program and a co-chair of the Student Leadership Circle, committee that works closely with the Division of Policy Translation and Leadership in hosting these Voices events. It is my honor to introduce today's speaker, Boston Mayor Thomas Menino, also known as the Public Health Mayor. Throughout his distinguished career, Mayor Menino has promoted the notion that good governance is about helping people. Elected 5 times as mayor of Boston, having served continuously for 20 years, and elected 5 times as city councilor from Hyde Park, Mayor Menino has spent a lifetime building a better Boston for residents and businesses. His portfolio of accomplishments include reducing ethnic disparities, combating substance abuse, promoting healthy nutrition for children and adults, increasing the city's supply of affordable housing, and as we saw in the spring, bravely leading the city in the face of mass violence. A graduate of the University of Massachusetts, Boston, Mayor Menino was awarded an honorary degree from Harvard University this past spring, praising his decades of service and strong leadership following the Boston Marathon bombings. Before I turn the session over to our moderator, Dr. Timothy Johnson, senior medical contributor for ABC News, please join me in welcoming Mayor Menino to the Harvard School of Public Health and to the decision-making Voices from the Field Leadership Series.
Mr. Mayor, over my many years at ABC, I had the chance to meet you quite often and talk with you, and it's a great pleasure to see you again here for this 100th anniversary of the Harvard School of Public Health. Congratulations to you all.
I'd also like to congratulate Harvard School of Public Health for 100 years of educating us on the issues of public health. It's a major issue in our city and our country, and how you integrate with the City of Boston and other agencies within the city. It's a very important school in our city. It helps us a lot, and we know a lot of the faculty at Harvard School of Public Health also. They work with us, and it's very important. This guy, he knows more about health than I do. He's the expert. I'm just here as an elected official. You know.
But as the premier elected official in the city, I'm going to ask you some questions very quickly about public health, very directly. But we cannot pass up the opportunity to have you describe what it was like to be mayor on the infamous day of the Boston Marathon bombing. You were in the hospital when you first got word. Give us a first-person account of the next 12 hours, what it was like for you as mayor, how you had to interact with others.
Oh. I was operated on Saturday, and I was in hospital recovering. And Monday afternoon, around 2:50 in the afternoon, that's when the first bombing went off. I was meeting with some of my staff at the time because we met daily in my office in the hospital room, and all of a sudden, one of my security officers comes in and says, "Mayor, a bomb just went off for the marathon." And I said, "Oh my God!" And I said to my staff, "Okay, where's the police commissioner?" He was on scene. He called me and told me what was going on there. I said to everybody, "Just now, we keep everybody calm. Let's execute our plan." And so over the next couple hours, you know, the governor and I spoke. There was a couple of briefings, and my doctor said, "You can't leave the hospital." And I said, "I'm leaving." He said, "What do you mean you're leaving?" I said, "Watch me put my pants on, put my shirt on, I'm out of here."
First step.
That's right, first out of there, out. And so I went over to the Western Hotel, where we met with the ATF, the FBI, Boston Police, the governor, and we talked about what was going on and what we knew and what we didn't know. And I'm cutting short the second bombing also that was there, and how we're going to deal with it. I mean, of course, the FBI took the case over from the state and local police, but my job as mayor, I thought, the next 12, 24 hours was to make sure everybody in the city understood that we were in charge, that the terrorists weren't going to stop our city, we're going to take over our city. That's the foremost thought I had in my head. We're in charge, make sure that there was calm in the city. But within the next 12 to 24 hours, I said to myself, we have to do something for these victims. And that's how the one fund became reality. I said I only wanted one fund in the city. I didn't want 16 different funds, because if you have one, everybody knows where to send the money and you get out as quickly as possible. But we kept on getting rumors about what was happening, and the police commissioner was talking to me all the time. The governor and I were having a conversation, and I left the hospital several times to brief the public on what was going on. We didn't have much information, honestly, but our job was to understand, to tell the people exactly what we knew and keep them informed also. Because I always believe when you try to hide the issue and don't be out front on it, that's how you get in trouble. That's how you create controversy and anguish amongst your constituency. So that was happening. Then Wednesday, the Tuesday afternoon, the president called and said he wanted to come to Boston and do an event. We did the event at the Cathedral Church, and the governor and myself all gave talks, and then we met with all the volunteers who helped. The real heroes of the whole marathon, I think. Yes, police and fire, they were doing their job, but the medical staff and the volunteers are the real heroes who went beyond the call of duty. We thanked all of them, and then we went over to Mass General Hospital and the president met with some of the survivors. I went back to my hospital, Brigham Women's Hospital, and I went upstairs and met with many of the survivors that were in the hospital at the time. The interesting thing about the whole, and that was Wednesday. Then Thursday, the rumors were continuing about what's happening. On Friday morning, around 1 o'clock in the morning, I got this call from Mitch Weiss, who's my chief of staff, saying that we had some information about this young man, these young men. And then a couple of hours later, the governor called me and said, we have rumors that there's a bomb at Charles Gate. There's something else happened in the federal courthouse. We have all these rumors, something in a cab also. And he says, we should have a lockdown. I'm not in favor of that. But I says, why? And he kept on giving me reasons why. Okay, I agreed to it because it worked out real well for us. It means I have to give the people of Boston and the surrounding communities a lot of credit. Everybody listened to us and stayed within their homes, which helped the police do their jobs during that period of time. But just aside to that, these survivors and these victims, let me tell you, they're the most courageous individuals I ever saw. When I went to visit them, they weren't, melancholy, sad. They were upbeat. It was just amazing to me. So then Friday morning we did call the shut-in issue. Governor and I met. They didn't want both of us together in the city around the possible areas where the bombs could be happening. So we went to the airport to meet, one of the hangars. And so we met over there, and then we got a call to go out to Watertown. Watertown was the focus of the investigation. And so we went out to Watertown, and then we had a false alarm that we had the guy. So I hung around there for a couple hours. Went back to the Parkman house where I was staying at the time, and my doctors kept on saying, "You okay? You okay?" I said, "Don't worry about me. I have a job to do." And so I went out there back to the Parkman house. As soon as I got back to the Parkman house, they asked me to come back to Watertown. We think we got him. And so we go back to Watertown, to the site where all the police were, staging area, and we had to wait about 3 hours before anything happened because there was one gentleman who stood naked in the middle of the street, and they thought he had bombs. He laid down. Nobody would move him. They had to call in a robot to help clear the site. So we waited around for 3 hours, and then around 6 o'clock that night, we got the call that they captured this young man in Watertown. He was in the boat. The issue that should be asked of this is, every police department had an area to cover, to go through and see what was happening there. How come nobody found this gentleman in the boat? That's a question nobody's asked. He was there. And the police went in there, and they started doing their thing. And my superintendent of police, Billy Evans, who was a wonderful officer, was the guy in charge. He told him, stop firing, stop firing. I was listening to it on the police radio. So we don't know what's in there. And when they stopped firing, someone went into the boat, found the young man, and he was injured seriously. He didn't have any weapons on him either. Didn't have any weapons. So we got him. They got him, brought him to the hospital, and then we came back to. I was at the command center. The commissioner of the department and the superintendent, some other officers, and the state police, the governor, and I, the attorney general. You did a press conference, but I'm sitting in the truck because I couldn't move at all. I was taken around in a wheelchair. I heard him on the police radio that we got him, Mayor, we got him. The police became relaxed at that time because they were on edge also. They didn't know what they had to deal with because, two bombs go off within several seconds of each other. They didn't know if it was a terrorist group or what was happening. And so the thing I was proudest of, after we did the press conference at 6 o'clock, 7 o'clock maybe, leaving there, how the citizens reacted. On all the street corners, driving from Watertown to the city of Boston, people on the street corners singing God Bless America, Star Spangled Banner, raising flags. The Boston Common was packed with police. They're packed over Hemingway Street. And my commissioner says, Mayor, all these kids in the streets, what are we going to do? I said, let them stay there. They're enjoying themselves. They were stuck in the house in the dorms for a whole day. Get them out there. Let them do what they want to do because they just want to express themselves. I think it was a good release for them. And that's basically how the week went. But the courage of these individuals that were hurt really impressed me. I've done several dinners with them. I've took them a week after the bombing back to the site. I wouldn't let the press come because they want to be alone. They want to be able to talk to them with themselves. And then I took them to dinner also that night. And I was down the waterfront. I wouldn't let the media in there also. And they were very happy about that because they're individuals who never had to talk to the media, and all of a sudden they're hounding them all over the place. And that's tough for them. And then we took when we took the memorial down, I brought them out also again to the memorial site just to make them aware of what we were doing. Took a lot of that stuff to the archives of the city. Some of the stuff that was there, some of the stuff couldn't save. And I took them to dinner that night also at down the waterfront. And they were so appreciative. And over the time, they've formed these groups to talk with each other, which I think is so helpful to them because I've gone to a couple of them. It's amazing the issues they have, and
Good forum for them.
Oh, it's a great outlet for them. They just express themselves, and sometimes they express themselves to me too, which sometimes but I understand that. And then this one fund we were able to. We didn't ask for one penny. All the money we got was given to us voluntarily. $61 million.
61 million.
The
Amazing.
business, it's right, because look at the other ones.
Yeah.
The other incidents we had in this country didn't raise as much. All this was voluntary. Everybody sent it in. John Hancock was the first one to send their donation in. Everybody else followed that. And we gave it away in 8 weeks. And now we're still getting some money into the fund. And the question is how we distribute the next cent.
So let me ask as a leadership question, as you had to relate to federal and state officials, was there any territorial tension that occurred during this unbelievable event?
No, I think we're all, if we all could work as well as we did that week, we have a better state. Mm-hmm. I'm seriously, let me tell you a little example of that. Down the South Boston waterfront, where the restaurants are down there, and some of those bars that you might go to, Priestley and all those other guys. I know the names, I don't go in them. There's an issue. For many years, there was only rail yards. No development down there at all. And now development's happening, and there's a jurisdictional issue of who's in charge, Boston Police or State Police. The State Police say they're in charge. Well, it's about us be able to work together. We do that in so many other roads. I don't understand why we can't work as well as we did at the Marathon issue as down on the waterfront. It's a real problem because you have a lot of development down there, and the Boston Police know have a lot of issues, know the issues around the young people of our city and how to deal with some of this stuff. But that week was really an example, a case study of how law enforcement work together. Myself and the governor always work together anyways, but how we helped each other during this whole week. It was a tough week. I mean, personally for me, I was just recovering, but that was okay. When you're a leader, like a dean or the mayor or something, you have to show leadership. You have to be out there. People said to me, you don't have to be out there, Mayor. If I wasn't out there, who would be out there? You gotta be out there telling the folks what's happening, keep them informed. That's so important when you're a leader. And that's why will always take the leadership part. Just go out there, even if it hurts, you go do it. Because that's why you get elected.
Those of you who read the New York Times Magazine interviews know they suggest, well, we won't talk about Detroit, but we'll just talk about Boston here. Know that the claim is made that 50% of the people of Boston claim to have met you during your tenure. That's amazing.
Yeah, I just do seriously, you get elected to a position or you're made a position, you have to get to know who your constituents are, have them have faith in you, and trust you. Trust is the biggest thing. And over my 20 years as mayor, I've been out in the neighborhoods all the time. I enjoy the neighborhoods because the neighborhoods give me information what's going on out there. At City Hall, they give me briefing sheets and all that stuff. They want to, their ideas. But I go to the neighborhoods, I make a little different version of what's happening. And that's what fuels me, is being out there. Like when I was, when I wasn't hurting the legs, but I used to go to 2 or 3 coffee shops in the morning. I don't drink coffee. Just to listen to people, just to see what they were saying. Some people say that's simplistic, but that's why when you're a mayor, mayors are the closest thing to the people. We buy our gas, we buy our newspapers, we go to restaurants, we meet our constituents every day. Some elected officials never get to they're 800 miles away.
So let's apply that theme, that thought to public health issues in the city. How do you hear from the people when it comes to health issues? You've got all the officials you pick carefully, all the leaders in the health industry, but how do you have the equivalent of on-the-street information when it comes to their health concerns?
Well, been engaged in some of these issues. The obesity issue, how I got involved in that. I went to one year, when I first got elected, I went to a Thanksgiving giving away turkeys. I see this kid who's 12 years old. He had to weigh 250 pounds, he weighed 1 pound. I was there with my public health commissioner. I said to Barbara, I said, Bob, this young kid doesn't have a chance. He's so overweight. We got to do something with that. And that's how we started our campaign of educating the folks on proper nutritious meals and things like that. That's how we stopped selling sugary drinks in our schools. Toughest political fight I ever had. Taking Coke machines out of schools. You know why? The teachers and the parents are against you because they make all their money for their field trips. But I say, mayors usually win. And I won this one. As much, because Coke and Pepsi, they make so many different varieties of drinks. It doesn't have to be tonic. But how do you get it? I mean, I have friends in the gay community. I took my first position in the gay issue way back when it wasn't popular. I listened to them over the AIDS issue on Needle Exchange. It wasn't.
That's why you're still a councilman.
Yeah, well, a counselor, yeah. And I stay, I represent Hyde Park and Rosedale, which is probably one of the most, everybody talks about South Boston being conservative. I live out in Hyde Park and Rosedale, and Rosedale and those areas. We're a little bit more conservative, I think. We don't show it as much. I took that position I didn't
Clean
get
needles, clean needles.
clean needles. I didn't get any static at all. Nobody gave me trouble. So some of these issues that get blown up in the media, they're really not issues. You really look into it. People care about some of these issues because it might be their brother, their sister, their friend. It's just a different world that I find than when I read sometimes in the media that they make, AIDS. Then those days it wasn't as common to talk about. There was no solution. Now we have something we could do, but that's how you do it. I mean, the South Boston Parade. How do you do that? That was one of my fun ones. When I was mayor, just about maybe 2 years, the folks in South Boston banned the gays from marching on the parade. And, they had to go to court. They were still in the courts, and I made a statement that I'm not going to march in the parade. And all my political people said, "You can't do that. It's going to kill you." I said, "But I'm the mayor of all the people. I don't discriminate against who I represent, who I'm speaking for. I represent all the people. I'm supposed to make decisions for all the people." I made that decision. It never hurt me at all. Maybe I'm different, but it didn't hurt me politically. I got elected 5 times. I mean, one time unopposed, and most of the times I won, But just being honest. Folks starting out in your careers, always be honest and upfront and communicate with people. I communicate with a lot of people during my day. It isn't the people at City Hall, but people in the professional world out there, community development corporations, health centers. I communicate with them all. That's so important to you.
Talk about the smoke-free zone battle. How was that?
Oh, the smoke-free, that was a great one. John Auerbach was my public health commissioner at the time. We were discussing some issues, and he says, "What about the smoking issue?" I said, "I don't like smoke myself." I says, "I don't smoke." And he says, "We should do something." I said, "Let's do something about it." So we came up with this plan to ban smoking in restaurants and workplaces in the city. That was several years ago. And we came up with a plan. We had to make an announcement of it. And I chose, I don't know if anybody knows Doyle's in Jamaica Plain. Probably one of the smokiest bars in the world. I did it on Valentine's Day. And I said, one of my opening statements, I'm doing this for people's heart, not allowing people to smoke. Remember when you used to go in restaurants and bars, you'd get all that smoke on your clothes? And the only ones I heard was the cleaners, because not as many clothes are going to cleaners now as they were. We had smoking. But 5 years later, the state followed us. But another issue, it was a tough issue, but it's the right thing to do. If you're a leader, I always say, like as mayor, people elected me for my thought process, what I believe in. And once you sell that out to other people, a special interest, you get out of the business. You get out of the business. I always believed what I believed. I took the position, and sometimes my staff would go crazy with me, but I believed in it, and I went forward.
So I want to ask a little about leadership style, and I'm going to read this little episode that was described this spring in the Boston Globe article about you as the public health major. And the writer was talking about the time when you were trying to get the Boston Medical Center and BU to unite. And it says, quote, "One night when negotiations at the city-owned Parkman House hit an impasse, Menino strode into the room, stripped off his watch, laid it on the table, and threatened to denounce intransigent parties on the 11 o'clock television news if a deal wasn't done. They missed the deadline, but kept negotiating and reached a deal a couple of days later." And one of the people who remembers Menino that night whispering to him as he left, "Hey, don't forget my watch."
That's right.
So my question is, as mayor, you have obviously a lot of power. How much consciously do you think about leadership in terms of the carrot approach versus the stick approach?
Well, sometimes use a carrot, sometimes use a stick. I mean,
Okay, we'll make the watch an example of the stick. Give me an example of the carrot.
well, when you're trying to educate people about, say, a housing development going to a neighborhood, where they're against it, you go out there and talk with them and tell them the real story. I mean, what happens in my business is there's elected officials who want to make get the names of the newspaper. All they care about is the name of the newspaper. They don't care about getting results. And I always believed it was about results as we go forward. They'd like to make any crazy statement. One time, we're citing a home for special needs kids. And all the people who voted for it, there's a packed room, hundreds of people. And all the people who voted for it get up and said that they were for it when they had to vote for it. They get in front of these groups, I'm against it. And I got really angry. And I was thinking what I was going to say. So I went up there and said, I'm for it. A woman stood up and said, Counselor, we elected you to do what we tell you to do. And I said, if that's the case, put a computer in my office. Just press yes and no. You elected me to think. I mean, think like, you know, I've been involved in some of those other issues where after the issue was out there and there was a lot of controversy about it, I go right back into that neighborhood and find out what I could do with that neighborhood to help them through the issue. You know, you might disagree on one thing, but there's always other places of agreement they come to. And I always found that in my career. There was always areas of compromise. You don't have to be hard and fast and everything. I always say to my staff, it's easy to get to no. It's much difficult to get to yes. Let's figure how we get to yes and work on getting to yes. Because you know, when people come to see me, I gotta say no, the issue's all done. But let's figure how we get there. We want to get it done, let's figure how we get there.
Terrific. We promised to save half the time for questions from the audience, so we will now open it up. Here's your chance to tell the mayor what you think or want to know.
Remember, I only have 108 days left.
Anybody. Great opportunity. Okay, we got the microphone.
Actually, I'm holding the mic, but I also have a question.
Okay, please.
And
just say briefly who you are.
Yes, so I'm Zach Nider. I'm a second year in the Health Policy and Management Department. And my question is actually about transitions, which I think you probably have something to... Transitions.
Oh, yeah.
So a lot of us are going to be graduating, going into the professional world. And even if we don't kind of begin at a leadership position, our hope is that we're going to work our way up there. And oftentimes we'll be replacing someone who's been there for, you know, a considerable amount of time. And there's always a lot of opportunity, but also danger in sort of that transition from one person to another, and making sure that sort of the historical memory of the organization is passed along to the replacement. And I think that probably there are responsibilities from both the new employee and the outgoing employee. And I was just wondering if you could kind of give your opinion on sort of leadership positions and transitions from one to another.
Or maybe give an example where you've had to exert some leadership in the situation of a transition.
I never had a transition.
Well, you better explain that.
When I took over as mayor in 1993, my predecessor left on June 12th at 5 o'clock in the afternoon. I'll never remember that day. But he left and just left town. We never had a discussion about what was going to happen or anything. He just left town, went to be the ambassador of the Vatican. I understand that. But I was a city councilor then, so I knew how city government works. But what I'm doing now, as I leave office, I've asked all my cabinet officials to put together briefing books on everything that's going on in the department, what the problems are, what the good things are, and what the future holds for that department. I've asked my financial team to put all that stuff together in a book and also show where the finances of the city are. But, you know, as a young person coming out of the School of Public Health, you know, you might not stop at the top. I have a lot of kids, young men and women who came from Harvard Business School, who are with me. I got 9 of them right now, I think. And they started off just as a fellow, but now some are taking over departments. My chief financial officer was HBS. She was started with me several years ago, and she's worked herself up to be. But, you know, it's about you showing the leader of the organization that you have the ability to lead, and also you want to get engaged. And it isn't about 9 to 5, or you want to go there just certain hours. You have to show you want to be engaged, and you want to learn also. Because, you know, coming out of public health school, you know a lot, but there's a lot more out there in the real world. And you have to find out what the real world's all about. Yeah, but, you know, ask questions, reach out to other people for information in the organization, and also in the outside the institution you're in, but just find that out. You know, leadership is about you and how far you want to go with that. You know, I think my chief of staff was a fellow out of the HBS, and he's done a wonderful job for me. I mean, so you work yourself, you gain the confidence of the leader, the CEO, or who it might be, and that's how it happens. You be honest all the time. I put that honesty in all the time. Be out there willing to work hard. You know, nothing comes easy. You have to want to get down there and do the work all the time.
And as a corollary question, how do you exert leadership when it comes to managing tension between staff people? Two competent people, sorry about that, but two competent people who have an honest difference of opinion and may even get a little personal, how do you manage that?
I'm the mayor. You do what I tell you to do or else. That's difficult. I mean, in my administration, I really haven't had personality problems that came on the surface. But if I had problems, I'd bring them together and sit down with me and say, let's figure this out. They're both valuable individuals. And it's just crazy that you two have this difference on these. Figure out how you come together and work together and communicate. See, a lot of this issue about tension between people working is they don't communicate. And that you have to communicate with each other, get to know each other. If you don't like them, you still have to communicate with them. You know, some people I work with all the time, I don't like at all. But my job to communicate with them and try to work with them. But that's what it is. Sometimes you have to, your own personal feelings you have to put in your sleeve and say, let's go figure out how we make it work. You know, some of these folks, the dean sometimes has to work with some people that he doesn't like. Yeah, but
You're next for the interview.
But that's what it is. It's you know, it's not any rocket science. It's about people. It's all about people. Your job, my job, his job, all of us. It's about people and how we want to treat them fairly and say if there's a problem, try to sit down with them. Have the patience to sit down with them and try to discuss the issue and find out where common ground is.
Next question, please.
Hi, my name is Lee Senderovich. I'm a first-year doctoral student in the Department of Global Health and Population. Oh, sorry. And as an aspiring scientist, I'm wondering if you could give any advice to those of us who spend a lot of time trying to produce rigorous, high-quality data, what the single best way we can communicate that data to decision makers is. If you have one tip for us.
Well, you have data. You want to get to the decision makers. Well, you know, if in school, find out from your dean who the people are that make those decisions. And like with my administration, when I have some folks, young people come to me with ideas, I either take them, I give them to my chief of staff or my environmental person, and that's how you flow up. You know, I never shut anybody out who wants to come in with ideas. And you have to find those people out there in the real world of what they are, who they are. Yeah, that's, you know, and also sometimes there's organizations out there where you can make a case to them and tell them what your research data shows. And also, you know, Public Health Commission, we have a great one in Boston. And that's how I do it. I find that, you know, folks like yourselves on school here, I always cherish the ideas they come with because, you know, you're young, a lot of vitality, you got new ideas. We have to continue to change those ideas, change what we're doing. If we stay stagnant, it means we're going backwards. And that's so important. And continue to move ahead. And we all do. The dean we all have to move ahead. You know, go forward. Don't stay status quo. Status quo doesn't work.
Next question, in the back there, please. And again, just speak up so we can hear, please.
Hi, my name is Veronica. I'm a first-year master's student in social and behavioral sciences. And I'm interested in your efforts with the mayors against illegal guns and how you came up with that idea and how you engaged the other mayors in that effort and what actions all of you are planning on taking together.
She's talking about the effort of mayors for illegal guns, how that got started, how you work with the other mayors now on that issue.
Yeah, that was 8 years ago. Mayor Bloomberg and I were having major problems with young people with guns and gun violence in the city. So Mayor Bloomberg and I were talking on the phone one day, and we decided we should do something about this. So I went down to Gracie Mansion down in New York, and we decided we had to create some kind of vehicle to get our message across about illegal guns. And so we met with 15 other mayors, and we started then about 8 years ago. Bloomberg and I co-chair the group. We have about 1,000 mayors now. I think we represent about 25 million people in this country. We're trying, it's not about gun control. It's about crime control. And, that's the whole issue. It's too easy to get a gun in America. We're probably the only industrialized country in the world that doesn't have some kind of control nationally. Every state has their own deal. We have some of the toughest. If you go to New Hampshire, you have the gun show loopholes. In South, they don't have any rules at all. You can buy a gun in a grocery store. So we need something. Too many kids are getting killed. Too many young people have guns. When somebody gets shot in the city, there's a homicide. The media always says, "What do you think about this, Mayor?" I always said the first question you should be asking somebody is, where did the gun come from? How did they get that gun? And that's the real issue. And Congress hasn't done anything. They're letting the NRA run the country when it comes to gun violence. They're running this country. It's a shame. Our delegation in Massachusetts is really good, but other delegations, they're all will bow down to the NRA every time a gun issue is raised. I understand the Second Amendment. If you need a gun for your own personal reason, yeah, but don't let it be so readily available through gun show loopholes and other things. I mean, look at this guy here down in Washington this past week. How did he get a gun? No background check.
Do you feel the organization is making progress? I mean, is this mayor's effort producing any tangible results yet?
We've got some we've made some progress over the last several years. Made some movement this year, but I'm not satisfied that we haven't got the gun show loophole closed. I mean, they want to put assault weapons back and say, what the hell we need assault weapons? They were banned for a long while. Why do we need assault weapons out there? That's a no-brainer to me. But we are making some progress, but we got to make a lot more progress. The availability of guns, I mean, what happens is they go down and buy these guns in another state, they come back with them, and they rent them out. Or they have neighborhood guns where they hide them under a bush, and they use them for different purposes. It's unbelievable. I mean, a kid 15 years old, how was he getting a gun? Somebody else is transmitting that gun to that individual. And that's, to me, that's wrong. And we should, our country, our leadership in Washington should pay for it.
Next question. Okay, here first, and then we'll move back to the second one.
Thank you very much for being here. My name is Germán Orrego. I'm a doctoral student in the Environmental Health Department, and I have a concern. I have heard that here in Boston, there are more people that die biking than for air pollution, for instance. How we can improve the cycle for bike or to avoid these accidents?
I'm the last 4 or 5 years, I've really started a cycling program in the city of Boston. We have lanes now for bike riders. We have the Hubway program. We can rent the bikes. We have educational programs for cyclists and trying to encourage them to wear helmets all the time. I mean, my issue is the folks who ride a bike all the time, I used to ride a bike all the time, understand the rules. Doing hand signals, having lights in their cars, wearing helmets and all that stuff. But the cowboys, I call them, they get in a bike and they just go. They don't care about what the rules of the road are. They're the ones that cause us problems. But the guys who do it every day and do it for recreational racing or recreational long rides, but we have to continue to educate them. That's why I get a lot of static about these bike lanes I've put in. They say they're taking parking spaces away. But also, I don't want the car to be king in Boston. I want the bike to be king because it's an environmental issue. Maybe I clean air in our city. And coming a long way. We've come a long way. I don't know how long you've been in Boston, but a few years ago, we were at dark ages when it came to cycling. We've made a lot of progress. I mean, the Hubway program we have, the rental bikes, that's unbelievably popular. It's unbelievable how popular that is in our city.
Okay, and the second person there, please.
Thank you for coming in. My name is Rebecca Obeng. I'm an MPA student here. My question to you is, you mentioned the NRA and how big of an influence they have. And I'm sure that you've also had a lot of resistance to other issues from different groups. And I was wondering, how do you...
Speak up on your
Yeah, just spell that out a little more.
Okay. So my question was, you mentioned that the NRA has a lot of influence in resisting gun regulation. And I'm sure that you've also had a lot of other issues where you've had a lot of resistance from other groups. My question is, how do you get around those sort of resistance? How do you talk to those people to try to get at whatever issues they have that are concerning them? And how do you bring them to the table to have a meaningful discussion?
And maybe a specific example of where there's organized resistance to something you wanted to do and how you dealt with that group or that organization.
I'm the mayor.
So you can always get their attention.
A couple of, one that's tangible, you can see, is the convention center down in South Boston waterfront. When I proposed that in the beginning, everybody was against it. Newspaper said it's a bonddoogle, a white elephant, and everything like that. So I had to bring the business community together. I had to bring the media together to understand what the economic benefit that was, and also would create jobs. And that, because, change in Boston is difficult, let me tell you. To get something to change, wow. But putting a convention center there, so every other city had a bigger convention center than we did. It was holding us back. I had 250,000 square feet. This is about 650 over in the waterfront. That was one of the big ones, was that, trying to educate the public on the convention center. You've seen it over there. And now there's a proposal out there to expand it even further, because we can't take some of the real large conventions in that are out there. And how do you pay for it? You have to get consensus on where you develop the money for the convention center. I got a great deal last time. I hope I get a good deal. I won't be here for that one. But all the money I put into it, I got back because of how we put the finances together on it. In the community, you listen to them and you try to work with them on the issue. And you have to explain sometimes to the public. They don't have all the information. They only have from the official meeting goers who make all the noise information. If you go out there and try to educate them, a lot of times you'll win them over. But, as mayor, I have a neighborhood service organization which goes out to the community they have different areas. It goes to every community meeting and brings information back to me so I know what's going on in all the neighborhoods of Boston. That really works well. That gets us information back so we don't make real decisions that are contrary to our neighborhoods. This is so important. Because they're our partner. See why Boston works well today, I think? Because our downtown is doing well, but our neighborhoods are doing even better. Neighborhoods aren't left behind in the city. If you look at some other cities, downtown does well, but the neighborhoods aren't doing well. But Boston, both are doing well. And that's so important as we go forward.
Okay, right here, please.
Hi, thank you for being here. My name is Leo. I'm an MPH student here at the school, and I have a question regarding the environmental approaches that you and your team were taking. So you carry out a plan that was called the Climate Action Plan and the Greenovate Boston, where you try to achieve a reduction in 80% of the greenhouse gases emissions by 2050. So I wonder, how are we doing so far with that?
We're doing okay. Matter of fact, 2 days ago we got the #1 rating in the country on the economic environmental issue, energy conservation. How we're doing that, we do New Boston, the solar programs we have in our city, educating the public on it and get them involved. Most of our new cars in the city of Boston are hybrids. We have some electric cars in our city. But the problem with this whole environmental issue is the public doesn't understand the vocabulary. They don't understand what climate control means. They don't understand sustainability. Somebody in this room should think about creating a dictionary and changing the words that we use on this environmental issue. Because I always believe the environmental issue was one of the next economies of our country. But it hasn't done that because the general public out there doesn't understand it. If I go to Hyde Park and talk about sustainability, it goes right above their head. It goes right beyond them. But the solar panels. I got solar panels in my house. I wanted my neighbors to understand how important it was to save energy. I get a check all the time for it. You know, we have more energy generated than I need. But how do you educate folks on those issues? We've done a nice job in the city of Boston. Renew Boston, we go out and check their homes for energy efficiency. We go out in the I was out in the neighborhood several times the past year in community meetings, educating the public on Renew Boston, what that means. And they do a great job of going to house to energy audits of your home. It's all, you know, the business community is really engaged. I mean, Spalding Rehabilitation Hospital, they're the first ones to really put all their mechanicals on the roof in case of flood, that they will not get flooded. Like New York, the big issue in New York is a lot of those buildings will never open up again because they get flooded right out. So you have to think about what's happening with our oceans, the rise of the ocean, and it's so important that we do those.
Okay? Here, and then we'll go back there.
My name is Charles Upton. I'm a second-year master's student in the Health Policy and Management Department. My question is also about cycling and the Hubway program. In a situation like the Hubway program where you're going to have benefits environmentally and with exercise, but you might also have negative effects from higher injury rates, how do you handle decision-making for decisions that have positive and negative public health effects?
Using the cycling program as an example again.
Well, cycling, you know, is good for exercise, good for the environment, it's good for your health, and just you got to educate the public. I mean, you know, come to down to City Hall Plaza this weekend. We have the professional bike riders there. We have professional races down there. Sunday we have the city's ride through the neighborhoods of Boston. But you know, there's no easy way of doing that. You have to educate them on what riding the bike is all about, wearing the right equipment, and we just got do it. I mean, in certain neighborhoods we do real well with the issue. Other neighborhoods we do very poorly. It's because of demographics also. Younger people are willing to change, willing to do things differently. Some of the neighborhoods we haven't got the younger people in there, and it's tough for them to change.
Okay, back here, please. Yes.
Hi, Mayor Menino. It's a pleasure. I'm Christina Radija. I'm in the Environmental Health Department, and I'm wondering, you oversaw the Big Dig construction. I'm wondering if you're satisfied with that project, and if you think we have any other big projects in store for us.
Big Dig?
What that might be.
Oh, Big Dig's worked out well. I think a lot of controversy about how much it cost, but let me tell you that it was worthwhile. The issue with the Big Dig, get down to the cost factor, is nobody was managing the cost. Nobody held anybody's feet to the fire on the cost and overruns. That was a major problem. But the finished product is great. I mean, if you go down there on the weekends, there's thousands of people there, the sprays and everything else. Now with the carousel you have there. But the issue we have to think about is how it's going to be funded in the future. And I'm worried about that. Because it can't become right now it's green. You have to continue investing in that greenway to continue the grass and the flowers and the bushes and have activities there. I don't want it to, my personal opinion, I don't want it to be a gravel pit. But what it's done is corrected the downtown with the waterfront. You know, I sometimes get criticized from folks, especially in the Globe today, not approving a building on the water, a tall 600-foot building. That would block the view of the ocean. We have a beautiful ocean. Why don't you put the building on the other side of the greenway, so you have a clear view of the ocean? We have a great harbor. We have great views there. If I let this developer put it there, next developer next door will say, I want to do it here, here, so you have a real wall of all buildings and no access to the water. That's what this is all about. Nothing else but that. But sometimes, they don't listen. That's only,
Other questions? Yes, please.
I'm Mayor Menino, Lenny Marcus. We did the Meta Leadership Summit for Preparedness together.
Yeah.
Thank you for your discussion about the Boston Marathon response. We're doing a leadership case study on this.
What?
And one of the questions that we're getting in talking with people from other communities that's really unique about Boston, and I'd be interested in your insights, is the resilience of the community. certainly the resilience of the survivors, but the sidewalks opened quickly, people got downtown. So from a mayor's perspective, from a leadership perspective, what were some of the key factors that you were thinking about in terms of the resilience?
Well, my first factor was Boston's a strong city. We came out of this much stronger than we went into it. But as soon as the ban was lifted on Trump on Boylston Street, I had my team go in there, my business team, my housing team, and go on and knock on every door, every business, and see what we could do for them. Be out there, be aggressive. We knocked on 500 businesses during this time. And our job was to get the place back in shape as quickly. I went out for lunch there, just to show people that the place was open again. You could do business on Boylston Street. But it was the message we sent there, that we're out there, we're alive, we're doing well, and there was nothing to worry about. But it was that my team, my Department of Neighborhood Development, Sheila Dillon, her team was out there, business people, knocking on doors, see what we could do, expediting permits, anything they needed. Taking rubbish, a lot of these restaurants had the food on the table, and they weren't able to open for 7 days, and the food was gone bad. And get them out of there and throw them into a dumpster and get them out of there. They're just by being there, helping them out, and showing people that we cared about them, but also show the rest of the city and the state and maybe the country that we wanted this place back in the same position it was before the bombing. And I tell you, it became a tourist attraction for a while. I mean, thousands of people came down there every day. They still do, because Boylston Street's a great place to shop and have a bite to eat. But it was just by us being there, my Department of Neighborhood Development, reaching out to people in the housing. You know, they had to leave their apartments, and how do we help them get back in their apartments? That was important.
Who would have thought a dumpster was key to the recovery? Huh? We had another one here, and then we'll go back there. 2 more here.
Oh, here.
Yeah, we'll get her first, and then this young man back here.
Hi, thank you so much for coming and speaking us today. My name is Maria Portel. I'm a student in the master's program in health policy and management. And my question is, with such a demanding job like the one you've had, and you've dedicated all these years to Boston, how did you manage to balance your political life with your family and your private life?
Oh, my family and my political life?
Yeah, how do you balance it?
I'm lucky, my kids are grown. So I don't have to worry about that. But your whole life becomes your office. I mean, you're 24/7. You know, and that's what it's all about. You make a commitment when you get elected. This is what you're going to do. You're going to be out there. You know, your phone rings at 2 o'clock in the morning. And something happens, you have to be there. But that's what it is. Your life has changed when you take that out. And I hope the new mayor, whoever he or she may be, understands that. It's not a 9-to-5 job. They have to be out there. That's how you gain the confidence of people. There's a fire, when I first got elected, there was a fire in Tremont Street. It was 2 o'clock in the morning. I showed up. They couldn't believe the mayor showed up at 2 o'clock in the morning. These people burnt out of the apartment house. That's what it's all about. Politically, you know, I always think where you govern and where you lead the city is the best politics you can have. And it isn't about politics. If you look at my staff at City Hall, 99% of them never worked in a campaign for me. Never worked in I always try to get the best individuals to head up my different departments. That's key, because, you know, you always try to get the best talent.
We have time for one really quick question and a quick answer. So can you make it quick, please?
Quick answer, oh my God.
I know. Sorry about that.
He'll probably have the toughest question.
Yes, so we were instructed not to ask about the next mayor, but maybe I can work around that by asking, as a citizen, what do you think is the quality that is most important for an effective mayor? Is it the friends they have? Is it the education they had? Is it the money they have? Or what do you think counts the most?
Let me just say, I don't think money should be a factor, but it is. It's too bad. They have to have a heart. They have to like people. They have to want to be engaged. That's the key to being a mayor. You have to be engaged. You want to do the job. It's not about making headlines every day. You know, my press person's with me. I go crazy. I don't want to be in the. I don't want to be in the press when I have to be. I'm not chasing them every day. But the next mayor has to understand the universities. I understand the health institutions and be friendly with the business community, but have a heart. See, the colleges and universities and the hospitals, they're the foundation of your city. And you're always going to work with them because they're the growth. When the recession hit every other city, Boston wasn't hit that hard because we were able to work. They were the growth factor. They were always growing. So I always tell whoever the new mayor is, first thing is develop a relationship with the college universities and the hospitals. And the business community always have a good relationship with them. Don't get in major fights with them. Doesn't work. I haven't done it for 20 years, so.
What I want to say at this point, Mr. Mayor, is as mayor for 20 years, you've inevitably had some criticisms of your ideas and your policies, but I have never once heard anybody say that your heart wasn't in the right place. And so for that,
thank you.
I thank you.
Thanks much. Thank you.